Hello, and thank you for joining us for the College of Alameda Certified Nursing Assistant Program. My name is Genevieve Gates. I'm the director and one of the instructors for the program. I am a family nurse practitioner, and I've been in the medical field or nursing field for about 20 years. So I'm excited to have you here, and let's get started. If you can, go ahead and mute yourself. And if you have any questions, you can reach out to me or at the end of the session. Okay, so we're going to talk about enrollment requirements, equipment, the first day of class, and attendance requirements. So welcome. I also want to give you some information about Eva Jennings. She is the Dean of Career and Workforce Education. And then there's my information, Genevieve Gates, Director and Instructor for the CNA. Certified Nursing Assistant is in high demand currently. College of Alameda has actually created a program that has no cost, non-credited Certified Nursing Assistant program. Our program will prepare you for the state exam, and it will also help you establish skills for successful work in an inpatient hospital setting and or a long-term residential facility, rehab centers, or adult daycare centers. So what does a typical schedule look like for a CNA nursing student? It is a 6-week program. We do have programs in the spring, the summer, and the fall. The first part of the program is a 3-week program that's lecture only. And then on the 4th week, you'll start your clinicals. There are some enrollment requirements. You need a background fingerprinting clearance, a physical assessment, a negative TB test within the past 6 months, or a chest x-ray within the past 2 years, a COVID test or proof of being vaccinated, BLS for healthcare providers from the American Heart Association, and a completed application with the College of Alameda. These are also some vaccines that are required for clinical rotation. You need 2 MMRs, tetanus, hepatitis B series, hepatitis C titer, and varicella titer. Some other certifications that we recommend, but it is not required, is a CPR, AED from the Professional Rescuer American Red Cross, and CPR and AED from American Safety and Health Institution. Financial aid. You don't need any financial aid because this is a no-cost, non-credited program. However, there are some other costs that may be involved with the program. For example, test textbooks and or PowerPoints, which will be roughly $90, clinical requirements, which is your TB test, your flu shot, your physical exam, or health assessment. If you don't have insurance, there might be some type of cost with that. Background and drug screen, scrubs and supplies, fingerprinting, and then also your CPR or BLS training. One of the biggest questions that we have is, can I still apply for a CNA program if I have some type of criminal background? All candidates must submit fingerprinting in order to test for the state testing. That has to be cleared. However, if you attend the program and you have some type of criminal background that hinders you from taking the state test, you still can pass the course. However, you will not be certified. Can I work while I'm in the program? We have no policy saying that you cannot work. However, the course load in the 6-week program is extremely high. There's a lot of lecture and also homework that is crammed into the 6-week program. So now I do understand most of you have to work. So if you work, just make sure you can balance work and school. The first day of class, you would want to bring all your supplies. We'll review the health requirements and course syllabus. And of course, you would not have to wear your uniforms the first day of class. Attendance is important. You cannot miss any class unless it's an emergency. You have to have a certain amount of hours in order to take the state exam test. We will have a fall program in 2021. The schedule is to be determined. Theory lab lecture is 3 weeks. It's Monday through Friday, 10 a.m. to 2:30 p.m. plus a skills lab as needed. Clinicals are 3 weeks, Tuesday through Saturday, 7 a.m. to 3:30 p.m. We have several sites in Oakland, Hayward, San Francisco, and also Kentville that we currently are using as our clinical site. Dress code, if you get chosen for the class, you need to make sure you wear appropriate dressing. For clinicals, you would have to wear white scrubs, white uniform pants, white socks, and white shoes if possible, and no clogs or shoes without a closed heel. Supplies, you don't need too many supplies. Blood pressure cuff, we will provide that to you by the school, blood pressure cuff and stethoscope. You will need a secondhand watch, a spiral notebook and pen. And if you have a laptop or a phone that has access to the internet, that is also required. Make sure you guys have a positive attitude, professional behavior, respect, and compassion for your instructors, classmates, and also clients. State examination for certification. Basically, after you complete the course and you are successful, you can now take the test, which is through the state of California. I believe it's a skills test and also a written question. So you would have roughly 60 to 100 questions and then 3 skills. During our clinical in-person lecture and clinical rotation, we do follow all the COVID-19 protocols. And also in our lab, we also continue to follow the COVID-19 safety and protocols measures with people. And that's the end of my presentation. If you guys have any questions or any concerns, you can go ahead and reach out to me and or Dean Jenny.
Okay, so what happens after someone submits the interest form?
So once you submit an interest form, it will go on a list with all the other candidates, and you will receive an email stating what you need for the program. And then once you have completed that, we were going to request for that to come back to us. And then we would let you know based on that if you're in the program. But space is very limited. We can only take about 40 to 60 candidates every semester. And we have about 300 to 400 individuals on our list.
Is there an interview process?
There is no interview process, but there is a mandatory orientation. And we do not have the date for that just yet.
So once they're in the program and they're working on the sites, do you assign the sites to them?
Yes, we do. We actually are the ones who will assign which clinical site you will be doing your clinical rotation at. And like I said, we have sites in Hayward, Oakland, and San Francisco and Kentville.
And is there an amount of hours that they need to complete before they do the examination?
Yes, you do need 60 hours of lecture and 100 hours of clinical.
So after you complete the CNA program, is there more training?
So I believe the CNA program is a gateway to all other medical professionals. You can become a nurse, you can become a physician, anesthesiologist. You can also become a LVN, phlebotomist, EKG tech. I feel like CNA is just that gateway, that foundation that most individuals need. And in my opinion, some of the best nurses, some of the best physicians, some of the best medical professionals start off as CNAs. Well, that's the end of our presentation, and thank you for joining me and everyone else out there, and hope to see you in the fall.